Hi there. Welcome back to CRC Health Connect. I'm your host, Dr. Siu-Him Chen. It is my pleasure to welcome Dr. Peter Ling joining our show today. Dr. Peter Ling is our diabetes specialist. Hi, Peter. I know you're very busy, so thank you for your time today.
Oh, thank you, Siu-Him. Thank you for inviting me.
So today we're going to talk about diabetes. As we all know, diabetes is a prevalent chronic health issue that bothers a lot of people. And it's often brought up by family doctors. And we hear a lot of news about diabetes as well these days, especially news about medications. So just want to chat with you today about basics about this chronic problem, chronic illness. So Peter, could you tell us what exactly is diabetes?
Sure. So diabetes is a condition where we have too much sugar in our blood, right? The body cannot use the sugar. Now, just to give everyone a background, in our body, there's a hormone called insulin. And the job of the insulin is to make the cells to absorb the sugar, right, as the energy. So when we do not have enough insulin, or if there is some problems of what we call insulin resistance, the sugar will have difficult time to get into the cells. Therefore, the sugar will get built up in the blood. And we know that when there's too much sugar in the blood, it can actually destroy the organs in our body, even though the patient is asymptomatic. So that's why diabetes is quite a difficult problem and very prevalent.
Yeah, that diabetes is often known as a silent killer, and we'll talk about that in a bit. So, yeah, it sounds like a serious problem. Then, how do we kind of screen for it? How do we know if we have it? And sort of when would that sort of screening start, even for like a healthy individual?
So yeah, the good news is that diabetes is easily picked up by regular blood tests. Okay, so your doctor can always do a blood test for you, and there are different kinds of investigations. The first kind of blood test is what we call a fasting blood glucose. So the patient will go to the lab in the fasting state before the breakfast, and then if the fasting sugar is high, that can suggest diabetes. Another common way to do the test is something called A1C, which is a measurement of how much sugar is in our blood, or in what we call hemoglobin, the red blood cell. The advantage of this test is that you do not need to fast. You can do it any time of the day. The idea is that it measures how much sugar is in your blood over the last 3 months. If the number is high, again, this may suggest diabetes. Now, the last way of glucose testing is what we call a 2-hour oral glucose tolerance test. The idea is that a person go to a lab and they give you a very sweet, very sweetened drink. After 2 hours, a normal person should not be above a certain number. If your sugar is very high, after 2 hours of the sugar drink, that may mean that you have some problem taking the sugar into your body, and they all end up in your blood. So this is the third way of detecting your sugar. Now, all these need to be confirmed again if one of these tests is abnormal, such that we do not have a wrong diagnosis of diabetes. But again, the good news is that all these tests are fairly available, and it is accurate.
Right. Yeah. I personally like to use A1C because that's just easier, and I think cardiologists often prefer that. So on that topic for A1Cs, what are the cutoffs for us to look out for? Like what exactly would be the diabetic range for A1C?
Right. So I will start with a normal range first. So a normal range of A1C should be less than 5.8. Okay. So let's say if you're 5.6, 5.7, you're still fine. But once you're above 5.8% to 6.4, we call these people in the pre-diabetes range zone, and they need to be very careful about their lifestyle, because if you're not careful, then you can get into the diabetes range in the near future, which is defined by an A1C of more than 6.5%. So anything more than 6.5% of A1C, this will suggest diabetes. And of course, the higher the number, the more serious is the diabetes.
Right. So if a patient is indeed diagnosed with diabetes, or that they don't know that they have diabetes, what happens when we let this problem linger without any treatment per se?
Yeah, you mentioned something which is quite popular, common findings I see every day. The problem is that many people, they don't feel any symptoms. They just feel fine, right? Oh, it's just a number, right? My sugar is high, it's just a number. I don't feel anything. The issue is that diabetes is a silent killer. The reason why is that the excessive sugar built up in the bloodstream can actually damage the blood vessels in our body. And remember, right, all our organs, right, from the eye, from the brain, all the way down to your feet, they are all consist of blood vessels. And anytime when there's damage at the blood vessels in these organs, the organs can be affected. For example, if the blood vessels in your kidneys are being affected, then people can get into something called diabetes kidney disease, right? They develop something called protein in the urine. This is always the first sign of damage of the kidney by the diabetes. Similarly, if you get too much sugar in the bloodstream in your eye, yeah, then people get into something called diabetic eye or diabetic retinopathy, right? So that's why our patients will require some regular optometrist or ophthalmologist follow-up to ensure that the eye is not being affected. If the excessive blood build up in the blood vessels in the coronary, in our heart, then people can get into coronary artery disease. If it gets to the brain, it can affect the health of our brain and sometimes result in stroke. So it does affect quite a lot of organs in a silent way.
So it's affecting us head to toe, sounds like.
Definitely.
Wow. So yeah, it's a problem because like other chronic illnesses, well, I know the heart per se. Often the complication is the first time that people recognize that they have the problem, right? You mentioned like stroke, heart attacks, things like that. I know that a lot of patients they're diagnosed with diabetes for the first time after their stroke or heart attack because that's the first time the blood sugars are checked.
Exactly. In fact, right, I saw quite a few patients, right? They came in with a heart attack or stroke, right? And they don't know they have diabetes until we check them at emergency room. So yeah, very, very, very true.
Yeah. So certainly something that we should really sort of deal with head on and treat. So in terms of the treatment plan, what encompasses sort of like a comprehensive sort of therapeutic sort of options for these patients?
So the treatment of diabetes consists of lifestyle management and also the medication. Now, for the lifestyle management, the most important for a patient to pay attention is what they eat, right? Because whatever you put into your mouth, it affects your sugar. Now, there will be a lot of discussion about what kind of food to eat, right? Because of the time limit, I don't have time to go over all these topics. But the idea is that some sort of carbohydrate can result in very high sugar, right? Those with high glycemic index, right, can make your sugar goes high rapidly. Of course, the way to answer these questions is to consult your dietitian or your doctor. So diet is very important cause of diabetes. Now, the second thing to do is to make sure we exercise. These days, lots of us have a sedentary lifestyle, right? So the idea is that if the more exercise one can do, the more energy we can burn out and the less calorie we store in our body. So exercise definitely will prevent or improve diabetes. Now, very lastly, I always ask my patients to ensure that they check the sugar at home. Some patients may rely on the regular every 3 months blood test from the GP or the doctor. Although this is good, it does not offer adequate information about your sugar, because if there's a way you can check your sugar daily or regularly, then you can change your lifestyle immediately. Now, in the old traditional way of testing sugar, we always poke our finger, right? That's what we call the capillary blood glucose monitor, right? Someone prick their finger, use a drop of blood to know where the sugar is. The good thing about this technique is that it's quite accurate. The only concern is that many people do not do it because they find it very painful to prick their finger, and it is quite inconvenient, right? If you have to do it, let's say at a restaurant or at your office, right? Because of the blood spilling over, right? People worry about pain, worry about infection from the pin, from the needle stick. So, and also many people, they have to check the sugar 3-4 times a day, right? Just to ensure that the pre-meal and post-meal sugar is good. So that will be a challenge for these people. Now, for the last 6 to 7 years, there's a newer technology called like flash glucose monitor or a continuous glucose monitor. What this involves is a sensor that you put underneath your upper arm, and this sensor can send signal to your phone about your sugar immediately. You do not have to do any invasive test. You don't have to poke your finger. It will show your sugar right away in your screen, such that you can adjust your diet and exercise immediately. And if you can do it right, your A1C after 3 months will also improve. That's my experience from my patients. Now, of course, if all these measures did not achieve the target of the sugar that we want to achieve, right? Then doctors have to think about using medications for diabetes. Now, the good news is that these days we have lots of new medications, both oral medication and injectable medication. Sometimes if the oral medications are being maximized, then we have newer injectable medication that patients can use. In the past, right, let's say 11, 12 years ago, right, we only have insulin, right? Let's say you use your oral medications maximally, then we have to use insulin, which is a daily injection. Now, these days, there is a medication you can inject once a week and also has quite a lot of potency in controlling the diabetes, and these can be used together with your oral medication. So in summary, we have lots of new medicines and new technology these days to help our diabetes patients.
Yeah, well, thanks for that comprehensive review. Certainly, there seems to be a lot of newer options for us to follow these days. So hopefully we can dive into some of these specifics, because I'm certainly very interested in learning more about, you know, at-home glucose monitoring, and if you can speak about you know, some of these new medications that are at our disposal. But yeah, thanks so much for your time, Peter, and I hope that we'll see you again soon.
Oh, thanks to him. Thanks for your invite.
We'll see you next time.
Bye.
Take care.